Breaking news in tonight's Health Edge, an FDA panel just backed the so-called Viagra for women.
It's called flibanserin, and that panel just voted 18-6 in favor of the daily pill made by Sprout Pharmaceuticals. Now, so many people are talking about this one tonight that we had to bring in Chief Health Editor Dr. Partha Nandi to answer some of our questions. So this is a really big deal. I know we've been talking about a pink pill for women for years, but is this a way to make money, or is this something you believe in, Dr. Nandi?
I really believe in it because I think that this is a condition that women have had for a very long time and really didn't have many solutions. You know, it's called hypoactive sexual disorder. So basically when women, you know, are suffering from having disinterest or low libido, and really there's not been very many solutions. So they estimate, Carolyn and Glenna, that 1 in 10 women can have this. So it's an enormous number of people that are affected. So I'm in support of it.
So, Dr. Nandi, it is a breakthrough, to say the least. Do you think it really works?
I do. You know, and this is the thing. You know, it's not going to be for everybody. You have to talk to your doctor, make sure there are no medical conditions, medications, sometimes antidepressants, you're taking high blood pressure medications. All those can reduce your libido or your interest in sexual activity. So talk to your doctor first, make sure there's no medical conditions. So obviously not for everybody, but for those people that really have an imbalance that we think that we can identify in the hormones, this could really be revolutionary for them. This is a big problem for women, and you know, not very many solutions there. Also, remember, there's other things you can do. You can, you know, go to your doctor and talk about the things I talked about a minute ago, but also talk therapy, psychological issues, make sure there's not anything underlying before just jumping to the drug. So I don't want this to be a green light to say, people, you know, let's go on this drug, and this is female Viagra, and we don't want people to be hypersexual. This is just to be able to solve a problem that exists.
Dr. Nandi, let's talk about price for a second, because Viagra for men, I mean, the price is through the roof, and we know that was like the wonder drug for men. Is it going to be that pricey for women?
You know, this is a kind of a controversial topic, because pharmaceutical companies really, you know, spend a lot of money to make a drug. When a drug gets approved, you know, that price point is often high to make up for that, as you guys know. But I'm hoping that this will be covered by insurance, because this is really an underserved condition. You know, I think that people have not been giving this the kind of attention it should. So the price may be high, but I'm hoping insurance covers it, because a lot of our women are suffering from it, and you know, they need some help.
Well, Doc, I mean, we do know, we've seen many cases where Viagra has been overused, maybe sometimes abused. And we know women's bodies react differently to medicine than men, often more susceptible to things. So could this be harmful if it's taken in a wrong way?
Absolutely. You know, again, any drug, if it's not taken the appropriate dosage, could give you problems. So what I would say is definitely have a long conversation with the doctor. And not every medicine is right for everybody. And so especially when it's just released, doesn't mean you jump right on it. So absolutely, women and men, you know, if you take the wrong drugs in the wrong dosage, it could give you problems. So definitely talk to your doctor. But I'll go back, you know, now we have women who've really been suffering. I mean, when the FDA's you know, actually heard from some of the women who are suffering, I think that really swayed them, along with some of the data. But there have been women for years that have had this problem and nothing to solve it. So absolutely, with all of the caution we talked about, but could be a revolutionary breakthrough.
All right, Dr. Nandi, thank you so much for talking about the pink pill for women. A big talker today, for sure.
Absolutely. I think it'll be great. And we'll see you guys tomorrow, okay?
All right, Doc.